Hi, everyone. Happy Wednesday. Welcome to It's Worth a Shot, our weekly kind of TED Talk format learning style presentation. This week, we are so privileged to have a couple of excellent speakers with us, Kyla Newland and Jesse Kinsey, who are going to be talking about adverse drug events and medication stewardship programs. So welcome to both of you. We're so glad you're here today, and thank all of you who are here participating. We hope that you enjoy and learn a lot in today's session. Next slide, please. So just a couple of updates and reminders. We are putting some links in the chat for you. And I think, thank you, Miranda. She has already done that. Just talking a little bit about fact sheets for pneumonia. Our up-to-date vaccine guide is also included in there. Jesse Kinsey, who is here from PharMerica today, also has some information which we're sharing in the chat, some links for you. Next slide, please. I know these are going to be really valuable topics today. We love hearing from you. We love knowing what works for you, what's useful for you, what are you wanting to learn about in these upcoming weeks and months. So please add your webinar topics into the chat if you want. If you're not comfortable with doing that, you are most welcome to add that in as you do an evaluation after the presentation today. So feel free to put it in your eval too in the comment section. We'd love to hear from you. We know that when we address things that are important and relevant to you, they end up being more useful, and then we keep everyone safer and healthier. So thank you guys for that. We are continuing to meet each Wednesday. Next slide, please. Okay, so last week we had a great question about variants for COVID-19 and if EG5 was circulating in our region. So when we took a look at that, here's what we discovered. There's not a lot of public data, not for all the regions around the US, on the current variants. And a lot of that's due to reporting. But we did want to provide you an interesting way of looking at circulation of the variants, and that is there is a national wastewater surveillance system, and that is in use, and so specimens are submitted each week from a lot of areas around the United States, including a couple of our states, Alaska and Wyoming, who are showing the EG variant present. So we are going to put a link into chat to that for you as well. I will do that in 1 second. And feel free to take a look at that. You can break that down by any area that is currently providing specimens to the CDC, and then they publish that. You can see at the bottom all the variants of concern, and on a national map, if you look at it, you'll see all the dots in the different colors. Next slide, please. So speaking of COVID-19, we give you a weekly update on how that's looking for our United States area and our region in particular, if there's something to address. So just knowing our hospitalizations are up and up quite a bit. So over the last several weeks, that's a pretty significant increase. That 18.8 is just in this past week. The death rate is also up. Our vaccinations continue to go up, but they're very slow at going up. So just an FYI there is a link at the bottom of this page. Follow that data tracker there on the CDC, and you'll be able to break that down by your specific county. Next slide, please. And here's a picture of how it's looking for us around our region, as well as the rest of the United States. And that's really taking those percent changes and looking at the percent changes in hospital admissions around the United States. And as you can see across our region, so in Hawaii, Alaska, Montana, and Wyoming, and our outer Pacific Islands, there are definitely some areas of concern where you see some substantial or moderate increases, and those are in orange. So keep an eye on that. This is a great time to review and update your best practices to keep everyone safe and healthy from COVID. Next slide, please. Now I'd like to turn the time over to Kyla Newland, one of our great pharmacists here at Mountain Pacific Quality Health, and she's going to talk a little bit about adverse drug events. Take it away, Kyla.
Thank you, Lori, and thank you for having me today. So we can go to the next slide. And really just starting out our conversation, I think it's really important for us to be able to define adverse drug events, which is not an easy task. I've been working on tracking and identifying adverse drug events ever since I've worked for Mountain Pacific for over 10 years. And it's really hard to do this because different settings may track adverse drug events differently. So I just wanted to start out with some definitions that are officially put out by the National Drug Action Plan. So basically, adverse drug event is this very broad term, and it includes medication errors, adverse drug reactions, allergic reactions, and overdoses. But if we look at the difference in what a medication error is versus an adverse drug event, a medication error is inappropriate use of a drug that may or may not cause harm. And an adverse drug reaction is harms directly caused by a drug at normal doses. So medication errors are things that could be a near miss event when we're talking about drug therapy, and even includes things such as adherence. So looking at how patients are adhering to their medication therapy. And then adverse drug reaction would be something more like a side effect that we would expect. This would include things that are at a normal dose we would expect in a certain percentage of patients, and also including things like allergic reactions. So if we can go to the next slide, this is just a nice visual, I think, that kind of shows that not all medication errors cause harm, and that adverse drug reactions kind of span both adverse drug events and medication errors. We can go to the next slide. So if we look at the magnitude of this problem, we're seeing a lot of emergency department utilization because of adverse drug event. And we know that there are patients taking more medications. They are at higher risk, especially when patients have other risk factors such as advanced age. And then this data does not even include outpatient events that may not even get reported. They may get reported to a primary care physician and mitigated that way, but not necessarily utilize the emergency department. So these numbers could be even higher. We can go to the next slide. So just looking at adverse events in skilled nursing facilities, this was a study from 2008 to 2012, and they really looked at these patients that were transferring that were, let's see, were they transferring? Sorry, I'm getting confused between the two studies. Yeah, so they looked at patients that were transferring between the skilled nursing facility and the hospital. And they found out, and they did this in the first 35 days, tracking them after they returned to the skilled nursing facility. And this report reported that nearly 60% of these events were preventable. So that would be kind of those items that were on that medication error side, but moved over to the other side because we didn't catch them. We can go to the next slide. This is another kind of a care transitions study that looked at patients, and kind of the same results, showing that 70.4% were preventable. And the top ones being skin tears, pressure ulcers, and falls. Falls probably the most relatable to medication errors or medications in general. But just another thing to show us that there are a lot of room for improvement to prevent these adverse drug events. So we can go to the next slide. And really, as I mentioned earlier, the patients that are at highest risk for adverse drug events are patients that are taking multiple medications, patients that are older. We see this in pediatrics. Primarily, a lot of that is going to be attributed to use of antibiotics and allergic reactions. And then higher risk medications. So the high risk medications include opioids, diabetes medication, anticoagulants, and then the fourth class is actually antiplatelets, which really kind of gets lumped in with anticoagulants a lot of the time. So that's making up 50% of these emergency department visits. We can go to the next slide. So this basically just repeats what I just said. These are the 3 high-risk drug classes that we have data for at Mountain Pacific that CMS is driving with that National Drug Action Plan. So on the next slide, you can see some data. This is from our Medicare beneficiaries, Medicare Part D claims for our states, and it shows each drug class here and the prevalence of adverse drug events. So as you can see, anticoagulants are pretty high, and coming in second is opioids. So these are kind of some areas that I'm going to highlight a little bit more today. We can go to the next slide. And if you look at this report, this was an Office of Inspector General report that came out, and it was really looking at these adverse drug events. And almost all of these are related. If you look at number 2, number 3, number 4, 5, 6, and 8, we've got the antibiotics in there, are related to these high-risk drug medication classes. You can go to the next slide. So this is another Office of Inspector General report that just talks about how many Medicare beneficiaries are actually taking an opioid, and then how many patients actually develop opioid use disorder because they're used incorrectly. So twofold, putting them at higher risk for adverse drug events, but also we are under treating patients that were on opioids and then developed an opioid use disorder. So that's just another thing that I wanted to mention that would be a good area of intervention. We can go to the next slide, and we'll look at the anticoagulants. So really, if we're looking at the anticoagulants, there's a few things that we need to consider that might put patients at higher risk of adverse drug events. So these, the newer direct oral anticoagulants have pretty complicated dosing regimens based on different indications. And so if we're not using the correct dose for the correct duration for the indication, we could be putting patients at a higher risk of having these adverse drug events. And then also just adding to that the length of therapy, and then identifying any drug interactions that could put them at higher risk as well. We can go to the next slide. So this was just something I wanted to mention. Most patients, the majority of patients that take anticoagulants, the most common indication is atrial fibrillation. So this was a study that looked at patients with atrial fibrillation and dementia, and it's not clear that there's benefit versus risk because of their increased risk of bleeding. So this was just something to think about if you've got residents that fall in this category, and really having that risk benefit conversation with the provider and the family and the patient if appropriate. We can go to the next slide. So just a couple tools that you can use in your facility to identify adverse drug events. These are both really good tools, and I would encourage you to take a look at them. And then I think I have my resources slide, and really, so I've kind of laid the framework for adverse drug events, and Jesse is going to talk more about how you can implement stewardship programs that will help address and reduce the risk. So thank you, Jesse, for being back with us here, and I will turn it over to you.
Thanks, Kyla. I'm looking at all the names of the attendees and recognize everyone, and it feels like old home week. So thanks for having me on, you guys. I have recently rejoined the Pharmerica Pharmacy family as a strategic account manager for the West, and am a account manager for some of you folks that are actually on the line. So thanks again for being here, and thanks for having me. So like Kyla mentioned, you know, as we look at adverse drug events, how can we address those adverse drug events? How can we approach those types of situations, especially those high-risk drug classes that Kyla mentioned, those top 3? So that's where we pull in medication stewardship. And I have a question here before we get started. Quick polling question, I guess you could say, without the polling. So feel free to just type in chat. How many people have medication stewardship programs active in their facility beyond antibiotic stewardship? So maybe you have a opioid stewardship program or a diabetic stewardship program in your facility. I'd love to hear from you. Does anyone have anything active in their facility beyond antibiotic stewardship? Maybe even just no, but I'd love one. And that's okay. That's okay if no one does. This is the perfect timing to talk about these resources. Sounds like a good idea. Yep, I'm with you guys. Psychotropics, yep, that sounds about right. A medication safety officer, that's awesome. That's awesome. Okay. All right, well, thank you guys. Well, we're going to dive into kind of a number of strategies and resources to help improve prescribing practices and look at reducing inappropriate drug use and ideally optimize medication health outcomes. Again, wrapping that all into a medication stewardship program and ways to approach those and prevent adverse drug events. All right, next slide, please. So with that, what is a medication stewardship program? Really, these programs, they work to prioritize resident health outcomes related to significant diagnoses, including infectious diseases, pain disorders, psychiatric conditions. I saw someone mention that they do have a program in place for antipsychotics, so that's perfect. And the goal is to optimize therapy and reduce those risks of adverse events, promote education, and really help the facility develop a program that includes best practices, protocols, a system for monitoring medication use. And then this program ultimately, it should include your leadership support and accountability and make sure that you have participation of your medical director. Consulting pharmacist is huge, nursing, administrative leadership. So the goal is really to align all those key players and folks into these stewardship programs. And the programs really help to promote education while working and aligning those folks, but also kind of naturally as a result, you're improving compliance, you're reducing your risks for adverse drug events, and ultimately, what kind of bubbles out of all of this too is you establish yourself as an industry leader in your community by adopting medication stewardship programs. So it's really it's a win-win for everybody. Next slide, please. So I like to kind of lay the groundwork here with antibiotic stewardship. This is the program, and we talk about medication stewardship. This is kind of the founding father of stewardship programs. This was first introduced in around 1996, so 26 years ago, and it's really set the pace and inspiration to establish core elements of medication management. And we've seen the result of having such a program in hospital settings, acute care settings, and in long-term care settings. And really the statistics over the last 25 plus years have spoken to that. So when you look back, actually in 2005, 2006, we had antibiotic associated ADEs that were around 19%, just over 19% actually. And then when we took the temperature again, 2017, 2019, we saw as a direct relationship of having an antibiotic stewardship program in place, those ADEs fell to just over 12%. So there's a direct association between having a medication stewardship program in place, and just the baseline antibiotic stewardship. This is the one that we're all so familiar with, and you know, we have CMS guidance in place that kind of directs us a little bit, and we also have some CDC guidance in place and holds us accountable, and some tracking and reporting fundamentals. So at Farm America, we actually have a nursing facility program that is part of our pharmacy services that's available to our partners. And then I know a lot of folks, you know, you have homegrown programs, which was just fine, but this is just again, this is laying the foundation here. So next slide, please. So as we look at kind of those top 3 high-risk medication categories, that's where we see opioids come into play, and opioid stewardship, and really the potential of having a medication management program in place to target this category. We're starting to hear more about opioids, obviously because of our epidemic and crises across the country. We actually at Farm America have a stewardship program too here. We just launched it last year, and it's to better support our senior living and long-term care communities. Just recognizing that this was a hard one to start. How do you start this type of program? So laying out the fundamentals and the resources for folks. And the opioid stewardship program, it really seeks to promote appropriate use of the medication. So right medication, right dose, right diagnoses, right situation, and help optimize that pain management for that patient or resident. And again, the big goal, obviously, to minimize those adverse drug events. And then within this opioid stewardship, this is something that we're often reacting to, we're not proactive to, is really some baseline goals in there to prevent drug diversion, misuse, and abuse, reduce drug dependence. So there's some elements in there that help, you know, as far as policies and processes and procedures. So I did throw some data in here too that's kind of interesting. Now, this is a little dated, and I know there's some information out there that would be, I feel like, post-pandemic, but it's still trending, unfortunately, in this direction. But when you look at those age groups of 65 years and older, it's really interesting to see that relative rate change of drug overdose deaths increase drastically. So again, this is one of the top 3, as Kyla mentioned, unfortunately. Next slide, please. So when we look at the facility benefits of having an opioid stewardship program and just initiating that conversation maybe with your facility leaders, is again, it creates a proactive approach versus a reactive approach. So it helps to maintain your facility ahead of the curve when you look at CMS requirements and kind of regulatory repercussions, whether that's drug diversion or assessment of appropriate medication therapies, and then reporting of those irregularities, and in general pain management. So as with these stewardship programs, again, it just enables us to be a little bit more proactive. Next slide, please. So as we kind of build the layer from antibiotic stewardship to opioid stewardship, we'll start talking about anticoagulation stewardship. This is one that has some of the highest events of adverse drug events when you look at hospital emergency room admissions. But this is one that we don't talk often enough in our long-term care settings. So interestingly enough, in 2014, and this data, it kind of mirrors what Kyla had shown previously, anticoagulant medications eclipsed antibiotics as the leading medication class associated with those ED visits for adverse drug events. And roughly, anticoagulants cause between 8 to 10% of hospital medication errors. And when you put this as a total across the country, I think it's pretty eye-catching when you look at roughly 33 million hospital admissions annually occur from medication errors with anticoagulants. So again, anticoagulation stewardship, it's really built on that 25 plus years of antibiotic stewardship experience. And the goals are just, it's similar. Identify and prevent those prescribing errors, a proactive approach, and then really look at that importance of appropriate anticoagulation therapy and that selection of appropriateness. Next slide, please. So here's a nice graph. This one, very similar to what Kyla had shown. Hers, let's see, I think I have one additional drug class in this graph. Mine is still unfortunately trending in the same direction as Kyla showed, but you can see the direction of antiplatelets that trend upwards. And then interestingly enough, which we'll talk about here shortly, is diabetic agents. There's also a unfortunate trend up of adverse drug events and ED visits related to diabetic agents. And all these sources will be available at the end of the presentation if you guys wanted to look at these. Next slide, please. So diabetic stewardship, again, layering this is something that we probably don't talk about enough, and likely we don't have established in our community, our facility, or home. But diabetic stewardship is one of those top 3, unfortunately. And we look at an estimated 30 to 45% of all hospitalized patients, diabetes and stress-induced hyperglycemia, that is, it all circles back to ADEs with this class and with this population. So stewardship programs really seek to look at that diabetes education and reformulating that diabetes education and aligning the best resources that may be out there. Maybe that's continuous glucose meters, ways to better inform the patients about their resources, look to reduce patient harm, and really help to construct and develop and maintain best practices within your policies and procedures. So there's some studies out there that really, they've proven that the more we can educate those residents, that the risks decline and those ADEs decline. Next slide, please. So with that, I like to share forward and reiterate to make sure we prioritize our resident health outcomes and work with your pharmacy partners, leverage those resources that may already exist. Don't feel like you have to create something from the ground up. Your pharmacy partners, I know with the Pharmacy Farm America, we can run pharmacy reports and customize those reports based on the stewardship program that you would like to develop. Those consultant pharmacists are in your buildings. For those of you in skilled buildings, they're there every month. Host those conversations with them, invite them to your meetings, involve them in the development of your programs. That's definitely what they're there for. If you're needing assistance in development of your processes and policies, reach out to them. Medical providers are there. Involve the leadership, involve your nursing team. And then I've dropped in just a few resources for references needed as you look at medication stewardship, and maybe if you want to grow your programs a little bit more in your facility. So feel free to reach out and work to hardwire those processes and programs. So we all have to start somewhere. So thank you guys for having me. And I think next slide. Yeah, feel free to ask any questions. It looks like we're about to time, but thanks again. Thanks, Kyla.
Thanks, Jesse. Thanks, Kyla.
Yeah, thank you.
Yeah, if you guys have any questions, feel free to come off mute and ask them, or if you feel more comfortable, go ahead and pop it in the chat. Or again, you can place any questions that you have when you're filling out the evaluation for us, which we appreciate if you do. So do we have any questions for our presenters? Doesn't seem like it. Okay, let's go to the next slide. And we just want to thank everybody for participating this week. And next week, we'll have Kyle from Farm 406 presenting on mobile vaccine clinics for the fall season. And then also our facility vaccination dashboard with a presenter from Mountain Pacific. So we look forward to seeing you guys next week. And thank you for joining us this week.